no doubt that having an education is one of the great equalizers, and it's a great equalizer in terms of life expectancy. So the way we measure mortality rates is in number per 100,000. And the mortality rate for individuals in the United States, 18 to 64 years old, who have not graduated from high school, is close to 600 per 100,000. However, in contrast, the mortality rate for individuals 18 to 64 who have 1 year of education beyond high school, 1 year of education beyond high school, that group enjoys is the right word, a mortality rate of 250 or so per 100,000.
Less than half.
Less than half.
Well, the irony here is that the greatest health risk that our communities face is our failed school system.
I would contend that it is a greatest or a very major contributor. Absolutely.
Because if you cannot graduate children, if your system is not deft at graduating children and then preparing them to be in a position to go on to college, then you are in fact positioning them to be unhealthy, at least, not just unemployed, but unhealthy.
That's exactly
for their entire life.
That's exactly
You are literally shortening their life by sending them to failed schools.
That's exactly right.
And one of the reasons why I fight the way I do is because I understand the far-reaching implications of denying children access to a quality education. It's not just that they don't know how to read. It has an impact on many people's psyche. When you don't feel like you're smart, you don't feel valued. When you don't feel valued, you don't feel valuable. When you don't feel valuable, you don't do the things that are necessary to increase your overall life efficacy. Just general happiness and joy, mental health, physical health, and relationship health. We know that the longer you stay in school, the higher the probability that you get married, stay married longer.
Yep.
You have children later, and they're healthier. So it does start with the seed of education. And what I think needs to happen is there needs to be a disruption in the industry of education, much along the lines of Uber, the way in which it transformed the way in which we travel within a community. There needs to be a disruption in the way in which Apple changed the way we look at technology and made it more accessible. If we don't push the educational system to produce better educated people, then all the money in the world and transformational changes in the healthcare system will fall upon a population that's ill-equipped to utilize it.
Would concur with that. And one of the things I think about, in addition to the existing disparity in graduation rates by race ethnicity, where whites and Asians are, every survey you look at, generally higher, and Latinos, African Americans, and American Indians in particular, generally lower. The gap is closing, but a great gap exists. But when you superimpose on that the demographic shift that's going on in our country, the demographic shifts that are going on in some of our communities, where Latinos and African Americans are growing as a percentage of the population, we darn well better find those disruptive solutions, or we will be chasing more challenge with folks who are undereducated, more challenge with folks who are sicker than they might be otherwise. And I would say, to the point that you were making earlier, folks who are less engaged, civically engaged, and whether that's engagement in civic society or even in their faith communities. There's some evidence around that as well, and less able to manage the financial environment out there, which is no easy thing. So financial literacy, health literacy, literal literacy, and relationship literacy all suffer if we don't figure out how we get more young people, many more young people graduated from high school.
Well, I'll close here on this by saying that when we maintain the status quo of today's public education system, what we do is promise another generation is less healthy, less equipped to take care of themselves, and people who will live shorter lives. And as you suggest, as more and more of the country becomes Black and Latino, the implications are far greater, because you have a larger percentage of the country who are less capable of taking care of themselves and those around them, whether it be from a health perspective, a civic perspective, a relationship perspective, and or a parenting perspective.
Yep.
So we have to unhinge the gates of this system so as to open it up for more opportunity for more people.
Completely agree.